Hi, I'm Hayley. So I'm one of the psychologists who works in Karratha. I've been working here for a couple of years now. So psychologists are mental health experts who help people with overcoming difficulties. So they study how the mind works and what people do and don't do and how we can help them in those areas.
My name's Kristen. I'm a pharmacist at Karratha Health Pharmacy. I've been living in the Pilbara for the last 8 years, and it's my job to make sure our community has the best access and service regarding all their healthcare needs.
I've been in Karratha since 2007.
Hi, my name's Amira King. I'm a pharmacist. I've lived in Karratha since 2012. As a pharmacist, I'm here to enhance the quality of life of my patients and to give any medication or lifestyle advice to help improve them.
Okay, so during COVID-19, as a psychologist, we started to see people who were experiencing high levels of stress, and that can be financial stress, family home life stress, and some people experiencing depression or anxiety, and they may or may not have experienced that before. Some people who already had existing depression or anxiety or other mental health conditions, it worsened for them, so we helped them with finding some resources, some support, some coping strategies.
Yeah, I think this is 1 year when I have seen during colder months a lot more mental health than I have seen colds and flus.
Over the last 6 months, we've seen a lot of people present to the pharmacy with varying mental health concerns, ranging from anxiety, stress and depression. I guess this stems from a lot of people having employment changes, worried about medication supply issues, and often too being a long distance away from family.
During this recovery phase, we've actually seen some people who were coping quite well and their toolkit was working adequately for them start to have difficulties transitioning into the new way of life. So we've also been helping people with some stress management strategies and some extra tools for coping with day-to-day things. We've also noticed people who have been socially isolated are now expanding and finding a new support network or accessing previously existing support networks.
Because we are at the forefront of the community, people feel comfortable about coming straight into the pharmacy and speaking to their pharmacist about any issues they're having, especially due to the heightened anxiety people are having due to COVID-19. We are there to discuss any issues they have, especially if they are confused about their medications or have anxiety about what they should be doing in regards to their medications.
It's our job here at the pharmacy to make sure that we can help people get all their health needs and address all their health concerns through this pandemic.
Imagine that the situation we have found ourselves with COVID. At no other time do I recall human beings knowing that they depend on the next person.
As we're moving through the recovery phase, we're finding that people are getting back into their routines. So they may be still accessing psychological services, but they're rebuilding. So what we're trying to do is give them the tools to rebuild and reboot and how to adjust to the new normal, because our society, although we are in the recovery phase, it has drastically changed. So people are also adjusting to that in their home life as well as in their work life. So it's about trying to support them during that time and also identify their strengths as well as give them any additional tools or coping strategies they may need.
Here at the pharmacy we can provide information on your medication, but we can also provide information on where to access the best health professional to deal with your situation. This might include referring you on to a GP, a psychologist, a counsellor, the hospital or even the mental health team.
One of the most common ways to access a psychologist, which is more financially viable for most people, is to be referred through a GP mental health care plan. So the first step with that is to book in to see a GP, and then they can refer you to a psychologist for 6 sessions, up to 6 sessions. And after that time you can be reviewed and then access another 4 sessions over the calendar year. So that's from the 1st of January to the 31st of December.
For more information, please visit the eCrowd Pilbara website.